How to know if you have male pattern baldness. If you've noticed that your hair is looking a little thinner lately, you might be wondering if you're experiencing male pattern baldness. This type of balding happens slowly over the course of many years, and it's most common in men in their 40s, 50s, and older. Keep reading to learn what your hair loss might be caused by and how you can address it today. Things you should know. Watch for gradual hair thinning on the top of your head. If you're in the later stages of male pattern baldness, you may be able to see your scalp through your hair. Look for circular thinning or balding patches on the top and back of your head with a mirror. Keep an eye on your pillowcase and brush to note how much hair you lose. Losing more than a few dozen hairs daily indicates male pattern baldness. Method 1. Identification of male pattern baldness. Watch for gradual hair thinning on the top of your head. Grab a mirror and hold it up above you so you can see the crown of your head. Check for thinning hair starting at your forehead and working its way backward. If you're in the early stages of male pattern hair loss, you might notice some patchiness or loss of volume. If you're in the later stages, you may be able to see your scalp through your hair. This is the most common spot that men notice hair loss. Usually you'll start with a receding hairline that works its way backward over time. You might also notice that your hairline recedes into an M shape. This is a telltale sign of male pattern baldness. Look for circular, patchy, bald spots. If the front of your hairline is fine, grab a mirror and move it all around your head. Look for any thinning or balding areas, like on the top of your head and near the back of your head. In the early stages, these spots might just look or feel a little thin. In the later stages, they could expose your scalp. Hair loss is gradual, and it can take a long time to notice that you are losing your hair. If you're not sure, ask a friend or family member to look at your hair for you. Look for hair on your pillow and hairbrush or comb. Some hair loss on a daily basis is normal, and it typically grows right back. But aggressive male pattern balding leads to very noticeable amounts of permanent shedding. Keep an eye on your pillowcase and your brush to note how much hair you're losing while you sleep and while you brush your hair. If you notice you're losing more than a few dozen hairs per day, it's probably a sign of male pattern baldness. Consult with a hair loss specialist. To be completely sure if you are affected by male pattern baldness, make an appointment with a hair loss specialist, who is likely a dermatologist or physician with special training. Typical male pattern baldness is usually diagnosed based on the appearance and pattern of hair loss. However, your doctor will also ask about your extended family, particularly on your mom's side, and carefully examine your scalp under magnification with a device called a densitometer. Method 2. Techniques to address hair loss. Try a topical medication to stimulate hair growth. Over-the-counter topical medications may be able to slow your hair loss and stimulate new hair growth in your scalp. Dermatologists recommend Minoxidil, which you can find at most drugstores or even online. Simply apply the cream to your scalp twice a day and wait to see results. For most people, it can take up to 6 months to see any changes, although you probably won't see a full regrowth. Minoxidil works well for some people, but other people see little to no change. Be patient and keep using it as directed to see if it works for you. This medication can cause scalp irritation and headaches. Use a wig or a hairpiece to disguise your hair loss. Experts recommend trying this option first, since it's the safest and least expensive. If you're worried about your appearance, head out and purchase a hairpiece or even a full wig. Hairpieces can add some thickness and fullness back into your hair, while wigs will disguise your entire scalp. Try to go for high-quality, human hair wigs and hairpieces so it looks natural, and don't be afraid to try out a few different styles. Take a prescription medication if it's recommended by your doctor. Finasteride is often prescribed to men experiencing hair loss. This medication has proven to slow hair loss in 80% to 90% of men, and some even experienced hair regrowth. If you're prescribed this medication, you'll take a pill once a day, every day, and you can expect to see results in about 6 months. Unfortunately, this pill has to be taken long-term. If you stop taking the pill, your hair loss will return. Method 3. Causes and prevention of male pattern baldness. Look at male relatives on both sides of the family. Look at your father, grandfathers, uncles, and male cousins, any first and second degree relatives, and see if they still have a full head of hair. If they don't, take note of the degree of hair loss and ask them when they first noticed losing their hair. The more relatives you see who are bald, the greater your risk of male pattern baldness. One study from 2001 suggests that young men whose fathers have male pattern baldness are more than 5 times more likely to experience hair loss than men whose fathers do not have this condition. Check for signs of hair loss as you get older. The incidence of male pattern baldness increases significantly with age. In fact, your age is one of 3 main risk factors for the condition. Up to 2/3 of American men experience male pattern baldness by the age of 35, but that increases to over 80% for men older than 50 years. About 25% of men who suffer with male pattern baldness begin the process before the age of 21 years. Check out the side effects of any medications you are on. Medications and supplements that are used for cancer, arthritis, depression, heart problems, gout, and high blood pressure all have the potential to cause hair thinning or baldness. If you recently started a new medication and you've noticed that your hair is thinning, talk to your doctor. They may be able to adjust your prescription to avoid any serious side effects. Keep in mind that hair loss caused by medication is technically not male pattern baldness. Male pattern baldness is genetic, while hair loss caused by medication can be treated by adjusting your dosages. Conclusion. In conclusion, if you're noticing thinner hair or bald patches, these could be signs of male pattern baldness, a common condition especially in men over 40. Gradual hair thinning, visible scalp, hair loss on your pillow, and a receding M-shaped hairline are key indicators. Consulting a specialist is best for a proper diagnosis. Treatments include over-the-counter options like Minoxidil, prescription medications such as Finasteride, and non-medical solutions like wigs. Always check medication side effects as they can contribute to hair loss. And to all my viewers on YouTube, if you found this summary helpful, don't forget to subscribe to my channel, CheckOne, for more amazing content like this. Your support helps us keep bringing you valuable information and insights.